Hello, good afternoon. How are you? Um, I will start. Of course, we are revising what I've discussed generally. Then doing some revisions for further understanding of what we discussed. And I ended my last discussion with factors that affect flow of infusion. Factors that affect flow of infusion. If you have IV infusion on, there are factors that will make it difficult for you to give the proper amount of infusion as required. Some of these factors are the height of the container. Either it is bottle or whether it is a plastic container. The way the IV infusions come, they come in bottles, they come in plastics. So the height of that container will determine how the flow is going to go in. The higher the container, the faster the flow is going to be going. So you have to adjust based on how you do the calculation. Another factor is patient blood pressure. When patient is an hypertensive person, with that pressure of flow in the blood vessels, okay, it will affect how much drop is going in. The more pressure in the circulation, the more pressure of blood in circulation, okay, the more resistance it will give to infusion coming in, drops coming into the blood vessel. And of course, patient's position also counts. Sometimes you find patients sitting up, getting infusion, or lying down, depending on the situation of the patient. So these are things you need to be thinking about always as you encounter patients that will require infusion. Part of infusion or blood or things going into the blood vessel are when you are transfusing blood into a patient. Transfusion of blood into a patient. And we discussed that the person giving the blood is the donor. The person getting the blood is the recipient. And there are two forms of blood transfusion. Either it is direct or indirect. Direct is when you are giving infusion from the donor straight to the recipient. The two people will be lying down on the couch, the donor on one side, the recipient on the other, and the blood will be transfusing from the donor straight to the recipient. But of course, there would have been checkups already in terms of the blood group will have already been sorted out. And continue now in the revision, there is what we call calculation of dosages of drugs. Sometimes you give drugs to patients that are adults, you give blood to patients that are younger ones. The general formula for calculating dosages of tablets, the formula is, of course, desired amount over available amount, okay, equals to the number of tablets to give. So the desired amount the doctor prescribes over the available amount of the tablet will give you the number of tablets. Let us take this example. A doctor orders 40 milligram tablets of a drug. What will the patient receive? That is an adult. So to give 40 milligram tablets, okay, how many do you need when the tablet is 20 milligram? Doctor prescribes 40 milligram and the patient requires only 20 milligram. So what do? When the tablet is 20 milligram and the doctor requires you to give 40 milligram. It's simple now. The desired amount, which is the 40 milligram, the available amount, which is 20 milligram, will give you the number of tablets. So in 20 milligram, you have 20 milligram. In 40 milligram, you will have 20 milligram tablets twice. That will give you 40 milligram. That will be 2 tablets. For solution, this is the formula. When you are giving solution, the formula is desired amount over available amount will give you equals to how much tablet to use and how much you have on hand. How much tablet to use is the desired amount. How much tablet on hand is the available amount. And when you do the calculation, it will give you what you require. So let us look at the example. The example is, doctor orders you to give 80 milligram of gentamicin injection. And on the ampoule, it is labeled 160 milligram. Give 80 milligram, but the ampoule tells you, okay, it is 160 milligram per 2 mil. Simple. 80 milligram, which is the desired amount, 160 milligram, which is the available amount, equals to, you don't know how much to give yet, but it will be x over 2 milligram over 2. 80 milligram over 160 milligram equals to x over 2. The x is what you are looking for. So it will be 160 milligram, 160x equals to 160 milligram. Because you are multiplying 80 by 2, and you are multiplying 160 by x. So it will be 160x equals to 160. X will be 1 mil. So what you are going to give is 1 mil. When it comes to children, it's a different ball game. And there are different formula to use depending upon the nature of the child. If the child is an infant, you use Freud's rule. And Freud's rule says the formula is age of infant in months over 150 times adult dosage. And when you do that, it will give you what is required. When a child is over 1 year, it's a different formula. And this is by Young's rule. In this, age of a child in years over age of child plus 12 years times adult dose. Age of a child here is talking about age of a child plus 12 years, which is the adult age. And when you do the calculation, you find that what you are going to be getting is the dosage of the child, the dosage the child will require. So the formula is age of child in years over age of child plus 12 years multiplied by adult dose. There's another formula by Clark. Here, this is when you are using weight here. In Freud's rule, you are using age. In Young's rule, you are using age. But in Clark's rule, you are using weight of the child. And this is the formula. Clark's rule, as I've said in the material, this is calculating child's dosage using weight in kilograms. And the formula is this: weight of a child in kilogram over 70 kilogram times adult dose. And that is for that. Going to unit 3. Remember, I'm just revising some aspects with you. Unit 3. And unit 3 is about injection safety practice. Injection safety practice. Remember, I've already discussed earlier that most of the intervention in health, okay, include injection. Most of the treatments that you give in the hospital, injection is one of them, and injection is more than even oral medication, whether tablet or lotion, or okay. So remember, you need to protect your patient always when you are giving injection. Okay, and we should discuss how you are going to protect your patient. Injection and self-injection also has some risks. Some of the risks that are involved in self-injection include hepatitis A and B. Is a risk that you get when you are giving injection. HIV/AIDS is another risk involved when you are giving injection. Septicemia is a what also happens when you are giving injection. You are giving injection generally. Remember, septicemia is sepsis in the blood, meaning microorganism, bacteria, okay, have entered the blood, and they will cause septicemia. Some of the injection safety and prevention include injection safety and prevention. Some of them are for you to prevent injection, for you to provide safety and prevention of microorganisms. These are things you do. When you come to give injection, assume always that there's potential infection resulting. I assume that anytime you are giving injection, there's potential for infection. This potential for infection, these are the ways to handle it. As you know about the hospital, generally working in the hospital, good hand washing is very important. Good hand washing is very important in all procedures you do, including injection. Because when you wash your hands with soap, of course, not only water, with soap, the soap is going to be detaching microorganisms from your hand. Because soaps are slippery now, it's a slippery liquid now. So the moment you are rubbing your hands together, okay, the soap will be dislodging microorganisms on your hand. Also, in safety and prevention of injection things, always try to attend, or the managers should always try to make sure that the caregivers are attending training to ensure best practice of giving injection. Managers should always allow nurses to be attending training to ensure best practice, because things are continuously, there are improvements continuously in the health field. Generally, technology is improving a lot of things always. So attending training will help you in understanding the best practices that are there generally. There is also an aspect I want to talk about, that is importance of injection as a procedure. And I've said earlier that generally in health, during interventions, majority of injections, okay, are given. Majority, the treatment you give is injection. And about 90%, okay, of injections are given when you are giving injection. 90% of whatever procedure you are doing in the hospital, 90% has to do with injection. The remaining percentage of injection will cover transfusion. You know, you need injection there, you need needle, you need insertion of needle into vein when you are giving blood transfusion. You also give IV medications where you give bolus. Few meals are given at a go. And also IV infusions are all part of injection. So these are the ways, these are the importance of injection. Majority of injections, 90%, okay, are given as treatment. The remaining percentage of injection is either through transfusion or IV medication or IV infusion. Unit 4 has to do with waste management. And know that all over, not even in the hospital, you always have waste generated. Waste are generated in our houses. You can see the challenge you have in your houses when it comes to waste disposal or management. Because you eat, you do this, you do that, waste are generated every day. Even today in my house, the waste that have been generated for over a few days now have been packed to site where they are being disposed. Sometimes you have to do it on your own, or you have to do it through waste management companies. So in health, of course, hospitals generate waste, clinics generate waste, medical laboratories generate waste, and when they are generated, they have to be disposed. They have to be disposed. There's no way around that. And that is why advanced countries, okay, advancing countries, you just have to manage waste, because waste are generated. Waste from your defecation is waste from papers bottles you drink, minerals, water, sachets that are all this in the end. When you finish using them, they become waste. And when they are generated, they have to be taken somewhere for disposal. There are three main categories of waste generation in the hospital, of course. Number one is infectious sharps. We discussed that today. Needles, bottles that are used, all these are waste. And they call this one infectious waste, because those wastes that have been generated are infectious. Another category is non-infectious sharps. They are sharps, they are needles, but they are not infectious. They are also generated. And then you have non-infectious waste. These are not sharps, these are not bottles, but they are waste. Okay, gauze, this, that, all are part of non-infectious waste, and they have to be disposed. And for them to be disposed, the management have to decide that these are the waste should be disposed. And that is why in the hospitals you see, okay, cleaners